Bacterial vaginosis, often abbreviated as BV, is one of the most common vaginal infections among women of reproductive age. It's a condition characterized by an imbalance in the natural bacteria that inhabit the vagina. Normally, the vagina is home to a healthy mix of bacteria, with the most dominant being lactobacilli. These beneficial bacteria help maintain an acidic environment, which protects against infections. However, when the balance shifts and there's a decrease in lactobacilli and an overgrowth of other bacteria, BV can develop. Understanding whether bacterial vaginosis can clear up on its own is a question that many women ask, especially those who experience mild symptoms or even no symptoms at all. To answer this question, it's important to consider what BV is, how it develops, the symptoms associated with it, and what happens if it's left untreated. First, let's delve a bit deeper into what causes BV. It's not a traditional infection caused by a single pathogen, like a yeast infection or gonorrhea, but rather a disturbance in the vaginal ecosystem. The exact reasons for this imbalance aren't always clear, but several factors can predispose someone to BV. These include having multiple or new sexual partners, douching, using certain hygiene products, or even just natural shifts in the body's environment. It's important to note, however, that BV is not considered a sexually transmitted infection, although sexual activity can play a role in its development. When BV occurs, women might notice symptoms such as an unusual vaginal discharge, often thin and grayish-white, a strong fish-like odor, especially after sex, and sometimes vaginal itching or burning. But up to half of the women with BV may not have noticeable symptoms at all, making it a silently disruptive condition. So, can bacterial vaginosis clear up on its own? The answer is nuanced. In some cases, particularly when the symptoms are mild or absent, BV can resolve without medical intervention. The body is remarkably capable of restoring its own balance, and sometimes the population of lactobacilli rebounds, suppressing the overgrowth of other bacteria and returning the vaginal environment to its normal, healthy state. Studies have shown that spontaneous resolution of BV can occur, particularly in women who are not pregnant and who do not engage in behaviors that predispose them to recurrence, such as frequent douching or having new sexual partners. In these cases, the immune system and natural bacterial flora may work together to restore balance over a period of days or weeks. However, for many women, BV will persist unless treated. Even if symptoms are mild or absent, the imbalance can continue, and in some cases, it can worsen. Persistent BV can increase the risk of acquiring other infections, including sexually transmitted diseases like HIV, herpes, chlamydia, and gonorrhea. It can also cause complications in pregnancy, such as premature birth or low birth weight. For these reasons, even though BV might clear up on its own in some cases, medical treatment is often recommended, especially for women who are pregnant, those experiencing symptoms, or those who are at increased risk of complications. The standard treatment for BV involves antibiotics, either taken orally or applied as a cream or gel inside the vagina. These medications are effective at reducing the overgrowth of harmful bacteria and allowing the healthy lactobacilli to reestablish themselves. Even after successful treatment, however, BV can recur, sometimes within a few months. Recurrence is common, which suggests that the underlying factors that disrupt the vaginal flora may not always be addressed by antibiotics alone. Women who experience recurrent BV may need to consider lifestyle changes, such as avoiding douching, using fragrance-free hygiene products, and practicing safe sex. Some research suggests that probiotics, either taken orally or as vaginal suppositories, might help restore and maintain a healthy balance of bacteria. But more studies are needed to determine the most effective approaches. It's also important to distinguish between BV and other causes of vaginal symptoms. Yeast infections, trichomoniasis, and even normal variations in vaginal discharge can sometimes mimic the symptoms of BV. This is why it's important to seek medical advice if you're experiencing symptoms, rather than assuming it's BV or that it will clear up on its own. For women who have been diagnosed with BV but are not experiencing symptoms, the decision to treat is sometimes more complicated. In non-pregnant women who are asymptomatic, some guidelines suggest that treatment is not always necessary, as the infection may resolve without intervention and the risk of complications is lower. However, in pregnant women, treatment is generally recommended to reduce the risk of pregnancy-related complications. The risk of complications from untreated BV highlights the importance of monitoring and, when appropriate, treating the condition. Left untreated, BV not only increases the risk of sexually transmitted infections and pregnancy complications, but it can also cause pelvic inflammatory disease, a serious infection of the reproductive organs that can lead to infertility and chronic pelvic pain. In addition to medical treatment, there are steps women can take to help prevent BV from recurring. These include avoiding practices that disrupt the natural balance of bacteria, such as douching or using scented soaps and hygiene products. Wearing breathable, cotton underwear and avoiding tight-fitting clothing can also help maintain a healthy vaginal environment. Practicing safe sex, including the use of condoms, may reduce the risk of BV, particularly for women with new or multiple partners. Some women may wonder whether natural remedies or over-the-counter products can help clear up BV. While there is some limited evidence that certain home remedies, such as probiotics, tea tree oil, or yogurt, may have a beneficial effect, these approaches have not been proven to be as effective as antibiotics. In some cases, they may even cause irritation or make symptoms worse. It's always best to consult a healthcare provider before trying any home remedy for BV. For those who experience frequent recurrences, ongoing research is exploring new ways to prevent and treat BV. This includes the development of new antibiotics, the use of probiotics, and even vaccines aimed at supporting healthy vaginal flora. Until more is known, the best approach is to seek medical advice, adhere to recommended treatments, and take steps to maintain vaginal health. In summary, while bacterial vaginosis can sometimes clear up on its own, especially in women with mild or no symptoms, it often requires treatment to fully resolve and to reduce the risk of complications. The decision to treat depends on several factors, including the presence of symptoms, pregnancy status, and individual risk factors. If you suspect you have BV, or if you have symptoms such as unusual discharge or odor, it's important to consult a healthcare provider who can provide appropriate testing and guidance. Bacterial vaginosis is a common and sometimes frustrating condition, but it's also highly treatable. Understanding the causes, recognizing the symptoms, and knowing when to seek treatment are key to managing BV and maintaining overall vaginal health. Remember, your body has an impressive ability to heal itself, but it also benefits from support, whether that means making lifestyle changes, seeking medical treatment, or simply paying attention to your own well-being. Taking charge of your health means being informed, listening to your body, and seeking help when you need it. If you have questions or concerns about BV or any aspect of your reproductive health, don't hesitate to reach out to a trusted healthcare provider. With the right knowledge and care, you can take steps to ensure your comfort, confidence, and health now and in the future.